Everyone, welcome to the video from module 5.2.1. For this part of the unit, module 5.2, which includes both 1 and 2, we'll be talking about the axial and the appendicular skeletons. The videos for these won't be very long, as this information is going to be primarily covered in the lab section, but there is a few things that I just want to cover here, so the videos for these should be fairly short. As I just cover some of the conditions that you may see here that may be important. As always, follow these learning outcomes to know what you'll need for both the quizzes and the unit exam. So there are a few divisions of the skeletons that we need to talk about. The skeleton can be divided into two basic parts: the axial skeleton, again, which includes 80 bones, and the appendicular skeleton, which includes 126 bones. The axial skeleton is the bones associated with the central portion of the body and includes the bones of the skull, which have 22 bones, the thoracic cavity, or the chest, which has 25, the vertebral column, which has 24, and the sacrum and the coccyx. The appendicular skeleton is made up of the bones associated with the limbs and includes the pectoral girdle, the upper limbs, the pelvic girdle, and the lower limbs. Again, I want you all to highlight the bone markings that we talked about. So the bumps, the holes, the ridges that cover bones of the body are all called bone markings, and these bone markings represent the points of attachments for muscles. The structures responsible for forming joints and the openings through which vessels and nerves pass. Keep in mind the chart that was in the previous unit, the previous module, and just make sure that you're aware of all those. I'm going to slide through most of these so you can see them in video form if that's how you look over this, and if you don't look at the PowerPoints, so just bear with me, and I'll talk intermittently about some of the things that I think that you should know. So this is one of the things I want to highlight in this unit. You can have some curvatures of the vertebral column. You can have a primary curve, which is retained from the fetal curvature and found in the thoracic and sacral areas. You can also have a secondary curvature, which curves anteriorly and found in the cervical curvature and the lumbar. There are a few disorders associated with this. You can have kyphosis, which is an excessive posterior curvature of the thoracic region. You can have lordosis, which is an excessive anterior curvature of the lumbar region. And you can have scoliosis, which is an abnormal lateral curvature accompanied by twisting of the vertebral column. Continue with this. Remember, if you need to, pause this, but I'm going to continue to move quickly until we get to something of importance for the lecture. Osteoporosis is one of those things. Osteoporosis is an age-related disorder that causes the gradual loss of bone density and strength. We talked a little bit about this in the previous section, but when the thoracic vertebrae are affected, there can be gradual collapse of the vertebrae, and this can result in kyphosis, or an excessive curvature of the thoracic region, especially as humans age. You can also have a herniated intervertebral disc, which, when weakening of the annulus fibrosus, can result in herniation or a protrusion of the nucleus pulposus and compression of a spinal nerve. This results in pain and or muscle weakness in the body regions that are supplied by that nerve. And the last thing I want to talk about is some embryonic development of the axial skeleton. And during the third week, the primary germ layer forms along with the embryonic discs. And there are three parts that I want to talk about mainly here. The ectoderm that gives rise to the skin and the nervous system, and the neurulation produces the brain and spinal cord. And by the 8th week, all major brain regions are formed. You have the endoderm, which gives rise to the functional linings of the digestive, the respiratory, and the urogenital systems, as well as the associated glands, so the thyroid, the parathyroid, the thymus, the liver, and the pancreas. It becomes a continuous tube when the embryonic body undercuts and fuses ventrally. And you can have the mesoderm, which forms all other organ systems and tissues. It segregates early into a dorsal superior notochord, paired somites that form the vertebrae, skeletal trunk muscles, and part of the dermis, and then paired masses of intermediate and lateral mesoderm. The intermediate mass forms the kidney and the gonads. The somatic layer of the lateral mesoderm forms the dermis, parietal serosa, bones, and muscles of the limbs. And the splanchate layer of the lateral mesoderms forms the cardiovascular system and the visceral serosa. Then the bones of the newborn skull are not fully ossified and are separated by large areas called fontanelles. And these are filled with the fibrous connective tissue. The fontanelles allow for continued growth of the skull after birth. At the time of birth, the facial bones are small and undeveloped, and the mastoid process is not yet formed. By allowing this to happen, it reduces the stress on the female when giving birth, as the head can be very large to fit to the pelvic area. So by allowing this to happen, the newborn skull can continue to grow once it's been born. And this is also what we determine to be a soft spot in newborns.